Good morning, everyone, and welcome to Health Talk, Nassau University Medical Center. I'm Dr. Victor Politi. I'm the president and CEO of NUMC, a big hospital on Hempstead Turnpike that you drive by all the time and wondered what the heck is going in there. Well, today we have a guest speaker for us, Mr. Michael Gatto. Michael Gatto is an administrator at the hospital who's in charge of what we call transitions of care, or basically care coordination, which is something new in healthcare, which I think we'll find very, very interesting to talk about here today. Besides working at the hospital as our director of transitions of care, Michael's also a professor over at Hofstra University teaching healthcare administration. And we're very lucky at Nassau University Medical Center to have him on staff with us, as well as what's happening today in healthcare as far as moving away from volumes of care more to valued care, and moving away from things such as taking care of only sick people that present to the emergency department or to the hospital, but getting out to the communities and working on primary care and basically looking at well care. And so Michael has a very big role in today's healthcare environment, and it's a changing environment, whether we're talking about the Affordable Care Act, also known as Obamacare, and what's happening in healthcare in general. And not just here in Long Island, but across the cities and states, across the country, where we're actually moving into this risk-based care, where we're looking at people in the population and owning those patients. And we own those communities. And as a healthcare facility, I want to make sure that those people in those communities stay healthy so that they don't use my services. So it sort of sounds counterintuitive. Hey, I'm a hospital. I make my money off of sick people in the hospital. But yet here I am doing everything in my power to keep people healthy and keep them out of the hospital. And so there's a whole financial issue here that we're still working through. And there's a program called DSRIP, Delivery System Reform Incentive Payment, which we'll mention a little bit later on that we could discuss, that talks about how these changes will affect hospitals. But for now, let Mr. Gatto, Mike, why don't you tell us a little bit about yourself, about your background, some of the things you've done, and then we could talk a little bit about the transition to care.
Well, I've been born in the city and schooled out here on Long Island, and I've spent a good part of most of my career between Long Island and New York City. I went to Long Island University for both my bachelor's and master's degree. I have a master's degree in health administration, and I attended Columbia University for my executive certificate in ambulatory care management and financial strategies. And hospitals have always intrigued me. And so one of the few people early on in their career, I knew where I wanted to be. Mm-hmm. And while I didn't know it all, I knew that a hospital, its environment, the interaction with people and staff and the community was what I am impassioned to do, and continue to do it today. And I've served my community for the last 40 years as a critical care technician with the Big Hills Fire Department. So if you put that all together, it all amounts to embracing the needs and responding to the needs and the requirements of people in our healthcare environment today, and certainly in a very ever-changing society that we're in terms of our healthcare.
And you're right on the front line of that change. I mean, you are actually charged with, in the hospital system, in Nassau University Medical Center, which is a very large, a safety net public hospital here in Nassau County, and we have a very large percentage of our patients who are underserved. We have patients from the local areas, the Westburys, the East Meadows, the Wantaws, the Belmores. We have our patients, but we also reach out to some of the underserved areas when we bring those patients in, and we want to make sure that those patients receive the best health care they can. We want to keep them healthy. So that's a huge responsibility that you have. So tell us a little bit about what the transition to the care model is, and how are you going to take on this job?
Well, first of all, it is a huge responsibility, and I have to say, Nassau University Medical Center is certainly up for the challenge in both its resources, its staff, its qualifications, and the people that are there and present to serve you. And our goal as a safety net hospital is to serve our public, is to serve the communities we do serve. And in fact, with this new care coordination, as we will discuss in a minute, it really requires us to embrace community services and what really is going on within our community structure. Because whatever's going on out there is inevitably going to impact our patient, their health, their outcomes. So what do we have to address this issue? We have something called care transitions. And what it is, it's a very unique care coordinated model. It functions to ensure patients' needs and their preferences for health services, and as well as information sharing is done, and it's done in a way that produces what we believe to be a positive experience, positive health outcomes, and that is the goal. The goal is the wellness component, positive outcome, and we do it in a way that coordinates the needs of the patient from the time they're admitted to the point of discharge and beyond in the primary care and outpatient environment.
So you say wellness, and I mean that we've time and time again on the show, and I'll bring in specialists, whether it's last week with our dental specialist, Dr. Sadoff, or our cardiologist, Dr. Karius, whichever specialist I bring in here to talk about healthcare. We all go back to the same basic premise, that it's our job to keep people healthy, our job to make sure that they live a healthy life. They wear their seatbelt. They don't leave a loose carpet on the top of the steps that grandma could slip on and fall down. They brush their teeth. They watch the food that they eat, and they stop smoking, and they, all these important things that we all know about. But now you're taking it a step further. We know you have a heart condition. We know you have diabetes. We know you have high blood pressure. We know you have asthma, and that you go to see the physician or the PA or the nurse practitioner and they prescribe medication. We want to make sure, as part of your team, that these patients take their medication, that they follow up with their doctors. And so how are we going to do that?
Years ago, there was one perception in healthcare: cure me, recovery, get me better, and I walk through the doors, and I will manage my own care, my own wellness. And we have been proven, and we have proved time and time, that can't be the case anymore. Healthcare is complex. Issues surrounding patients today are very complex, chronic disease management. And the focus on how we manage these patients is key to their outcome. So that is a very, very substantial and a very good question in terms of, hey, you know what? Once you're out the door, where's our sense of control? And yet, it is that sense of control outside the door that will make the difference as to whether a patient fully recovers or winds up being readmitted to the hospital for the same condition. Now, first we have to drill down a little bit and look more towards what's happening in today's environment. We know that in the United States, healthcare is the most expensive component of our gross national product, accounting for almost 15%, and by 2019 will be close to 17 to 18% of our gross domestic product. That is a tremendous amount of money, and it equates to hundreds of billions of dollars annually. We also know that in the expense that we are realizing, the outcomes are not where they need to be. We recognize that patients leave the hospital only to be readmitted again for the same reason. And our ability to manage them becomes very crucial to what we consider outcome-based medicine, value-based medicine, the whole premise behind prevention, wellness, proper medication, access to care, access to community services. The coordination then of all those services as one unit in order to basically produce the best quality of life for our patients today. So with that in mind, we have to take into account what the fabric is and what's going on out there right now. Readmission rates, they're high. chronic disease management rates, they're high, and we started to do a pretty good job years ago as part of what we call patient-centered medical, the home itself, and we are doing much better. But still, chronic disease management and the follow-up care that's required is not necessarily there. We then add on this coordinated care, specialists, primary care, ancillary services, labs, and now we need to bring it all together, and we have a very difficult time. Even the electronic medical record, which is a very important part of our existence within the hospital today, is only as good as our ability to be able to properly share it with other healthcare professionals, other supportive care, other community-based services, in order to make the experience for that patient a whole experience.
So we know, in the hospital itself at Nassau University Medical Center, we're really receiving a lot of awards. We just recently received a Health Grades Award for gynecology, for gynecological surgery, 5 stars. So, and that's 3 years in a row. So I think we're the only hospital in Nassau County that received this Health Grade Award for gynecological surgery for GYN care for 3 years in a row. We just received some leapfrog data on safety issues. And I mean safety, I mean things like urinary tract infections in the hospital, patients who get infections because of intravenous lines, patients who get pulmonary embolisms or blood clots while they're in the hospital, which is a problem in a lot of places. And that we have decreased all of these, all these potential life-threatening conditions to a point where we received an A. So we received an A from this leapfrog group for all these different what they call life-threatening conditions, that we've reduced them to almost a negligible number. Right. And so it's an amazing, amazing what you don't realize. Nassau University Medical Center, we were surrounded by some great medical centers. We got some great hospitals. I mean, North Shore Long Island Jewish, a fantastic hospital. Winthrop, South Nassau. These are excellent hospitals. We in Long Island are blessed by having some of the best health care anywhere in the country, right here in Long Island. And to have Nassau University Medical Center located right in the middle of all of these great hospitals, and for us to be doing as well as we are in all of these different surveys and parameters and benchmarks and milestones, it really shows the type of care that we're giving for our inpatient patients while they're in the hospital. Right. So now we're saying we got to take that care that we're giving to our patients and extend that when they. So you're being discharged. You had a heart attack. You had a stroke. You had the greatest care, and we're sending you home. We're wheeling you out in a wheelchair to your family. You're getting into the car to go home, and now we need to stay on top of that because we want to make sure that you got your medication. Matter of fact, we even put a Walgreens pharmacy in the hospital. In the hospital, in the lobby.
Yes.
Is the pharmacy, so that we make sure before you leave that hospital you have your medication, because sometimes people go home and they don't have a car, they don't have a cab, they can't get their medication, and they don't take their medication, and then they get sick and they come back. And that's what you're talking about. You're talking about patients who are not taking their medication, their sugar goes back up, their blood pressure goes back up, boom, they come back to the hospital. Or they don't follow up at the clinic, they don't get their stitches out, they don't do the things they should do. And not because they don't want to, but maybe they can't. Maybe they don't have the resources, they don't have the car, they don't have a taxi fare. And your job now is to go out to make sure these patients, after we discharge them, get the care that they need outside in the community, and that we prevent them from having another admission, an unnecessary, or should we call it an avoidable admission, right?
That is correct. And it's those unavoidable admissions or avoidable admissions that not only result in greater morbidity to our patients, but also, hey, it's costly. Centers for Medicare and Medicaid, which we work very closely with, has looked at all these hospitals and said, look, you guys got to do a better job here in terms of avoiding these readmissions, all right? And we're going to penalize you if you don't start focusing on patient-centered medicine. So Nassau University Medical Center has taken up the challenge and said, yes, we can do that, and we can do it even better beyond the standard that has been published by what we call transitions of care. And as Dr. Politi suggested, yes, we follow you. as you're leaving the facility through a discharge. That's not where it started. It starts the minute you are admitted to the hospital. Our transitions of care team, in conjunction with very experienced case management nurses and social workers that are responsible for your inpatient experience and to identify the needs while you're in the hospital, at the same time are producing and creating your discharge plan. And what's unique about it is that at that same table, we have a member of what we call the transition of care team. Now, very briefly, a transitions team is made up, in our case, of bachelor's prepared coaches that are well-versed in urban and civic medicine, social workers, licensed social workers, and registered nurse as case managers. And we have a very dynamic director by the name of Terry Gray, who is a nurse practitioner and pretty much is at the heart of each one of these patients while they're in the health center. And at that same table, a discharge plan is created. It is discussed amongst all of those professionals, and then a care coordinator is assigned to that patient while they're still in the hospital. They greet them at their bedside as they're recovering, and as they're being discharged, they actually walk with them out of the hospital, and at that point, coordinate their care in the community, whether it be through primary care, our FQHC health centers, whether transitional housing, medication assistance, food assistance is needed. That care coach is central to that patient's well-being. And in fact, each of our care coaches is well-versed in that patient, has a cell phone in order to be reached 24/7 in the event there's an issue surrounding the patient. We coordinate and we even make the schedule of their appointments. And at the same time, we make sure that other community-based services that are required for them are in place so that there's a smooth transition, hence transition of care. And by the way, this is not just a patient who's simply going home. This is a patient who is maybe being discharged to a skilled nursing facility. For example, A. Holly Patterson, one of the foremost rehab and skilled nursing facilities in the New York area. And we follow that patient right into the skilled nursing environment, and upon discharge, either home or to another maybe longer term care. Why? Because by us doing that, we can assure an efficacy of care, proper wellness, avoidable readmission, and at the same time promote the ultimate value-based medicine that we have been committed to and we have committed ourselves to as Nassau University Medical Center. We are on the forefront of care transitions and wellness.
That's great. So, I mean, so the second a person is admitted, that team goes into action. And you start on their admission planning for their discharge, making sure that everything's set when they leave that hospital to continue their care to prevent these avoidable admissions.
That is correct.
And so these patients are really getting the best possible care throughout the whole continuum, whether it's in the hospital or at the discharge.
By all means. And as you know, Nassau University Medical Center and its almost 81 residency-type specialties and primary care can provide the entire experience to this patient. And again, which is why there's no reason to, and we don't discharge the patient so quickly. The average time a patient stays with a care coordinator could be 30 days. However, we have knocked down that wall of 30 days, and we have now established a policy to suggest when that patient is well stabilized within their home environment, within their community environment, and at that time we will still, every month, make at least one phone call to see how they're doing.
You're saying 30 days after discharge, not that we're keeping them in the hospital for 30 days.
No, we don't keep them
So
in for
after we
30 days.
discharge them
Right.
for
So
30
this is
days.
all after discharge. This coordination maintains itself. And we have a great opportunity here to make sure that the patient is well followed up, almost like a palliative process in terms of making sure those patients that have chronic diseases are kept healthy, maintaining their best quality of life by follow-up medicine. And we do that through the coordination of care department.
So we're really we're looking forward to opening up our new primary care center at the hospital. It's going to be a very large section on the first floor. I don't know if anyone's driving by on Hempstead Turnpike. If you look to the right, you can see that whole first floor is under construction. And it's going to be a huge state-of-the-art primary care center. It's going to be almost like, private offices. We're going to have medicine. We have OB/GYN services, pediatric services, all sorts of specialty physicians will be there available for our patients. They call up to NUMC. You can make an appointment to be seen there as far as our outpatient services. A lot of these patients that you're talking about that upon discharge need follow-up. And again, we have those, family health centers throughout Nassau, but we are also going to have this brand new primary care center at the hospital that'll bring them the best of care right there for them. And so we're waiting to open that, which should be sometime after the winter, around March or April or so. I guess, it's like construction, like anything else when you're working on your house. There's always something that comes up that needs additional work, and all of a sudden in the middle of the job you realize, oh, I want to put another window over here or something. So all these change orders go through, and it keeps delaying. But we're looking at somewhere around March or so to open up that primary care site, and that'll really help a lot with these patients so they can. We have our Omni clinics now. We have our primary care centers open right now, and it's full functioning at the hospital. But we're building this new facility to take over for those areas. And once we do that, we're going to have really a great, dental clinic downstairs, and we're going to have a simulation clinic for the medical students on the first floor. So we have a lot of things that are happening at the Nassau University Medical Center, I think, that are really going to establish NUMC as really a healthcare, one of the best healthcare providers in the area.
Absolutely, and the residents of Nassau County are open for a major treat here, because at the end of the day, this state-of-the-art ambulatory care unit with both primary care and many specialties will practice that same care coordination that the transitions of care practice. And in fact, we have opted not to limit care transitions to simply patients that are being discharged from the hospital. Our unique program, and truly supported by Dr. Politi and the hospital stakeholders, supports our outpatient patients as well. Because one of the things that we must identify is the potential for hospitalizations. And one of the things that we will do is align a care coordinator with patients that are coming in to see the neurologist or for surgery, or reaching out to even our new and high-tech neurosurgical program here at the hospital, and then bringing that all down into our outpatient environment. We will follow you as well, those patients who may be followed by a doctor for chronic disease problems. We will follow them. We will provide the same level of phone call. And in fact, we have also employed a rather unique program of Cypher Health that actually calls you to check up on you. And if any question is answered in a way that is suspect of your care, the care coordinator on that end relays that information to your care coordinator, and then we follow up with you to see how you're doing. And if necessary, we will make a home visit. So we're not restricted to just the clinical environment. Yes, we will make home visits when necessary, and we are particularly concerned about patients understanding their nutrition, medicine regimens, their environment. New York Times had a big article yesterday about something that we in healthcare already knew. Falls of our senior population are the #1 cause of severe injury and hospitalizations and debilitating injuries that potentially could lead to death. So at the end of the day, our goal in transition of care is to make sure that the entire wellness environment of the patient is maintained.
Right, and that's that primary medicine we talked about before.
Sure.
I mean, I've only been here, I guess, 8 months in my position. You've only been here a few months. I live in Belmore. I grew up in Long Island. You're a Long Island guy, local guy.
Sure.
Did you ever have any idea of all of these services or how good that this hospital really was? I mean, I had no idea, even growing up in the backyard of that Nassau University Medical Center, that we had all of these services, that we had this level of commitment from our PM&R, our physical medicine and rehab. I mean, that is a renowned program that other hospitals in this community send their physicians to. We have the burn center. We have the hyperbaric multiplace chamber for wound cares. That amazing.
Sure.
Brand new ICUs and CCUs. Brand spanking new. We didn't even open we didn't even cut the ribbon on some of them. But we have an 18,000 square foot labor delivery room that you think you're in a 5-star hotel. That's how nice that place is. And that the physicians, you mentioned the neurosurgical staff that we have. I mean, trained at Harvard, trained in Columbia residencies, fellowships. I mean, we have some of the highest trained physicians that are right here at our hospital. And you drive by it every day and you don't realize that this level of care is right there available for you 24 hours a day, 7 days a week. And now you're taking it to the next step. Now we're taking it, not only you're getting it when you walk in the door, now not only doing everything we can for you in the hospital, but we're going to follow you when you leave. We're going to follow you whether you leave, whether you're an inpatient or even in our outpatient center. And we're going to call you up to make sure you take your medicine. We're going to call you up to see, did you gain any weight? Maybe that means you're holding water and you need the amount of your diuretics adjusted. If you're having some wheezing, maybe we need to increase your medication from your asthma. And I think by tying all these things together, we will be able to, I guess, come up with what we're supposed to, and that is the DSRIP model, the Delivery Service Reform Incentive Payment Program. And maybe we could talk a little bit about DSRIP. I mean, the basic premise is to decrease avoidable admissions by 25% over the next 5 years. Now, face it, that's going to financially impact hospitals.
Absolutely.
So how are we going to survive this? How are we able to sustain ourselves in this space?
Dr. Politi, as you know, as the CEO of Nassau University Medical Center, and all of us who support the mission of Nassau University Medical Center, we are embarking on a brand new healthcare delivery system. And Nassau is leading the way in terms of the provision of care, and the like. But in the United States, DSRIP is redefining what healthcare is all about. And it's about everything we just talked about in a coordinated means that should equate to a better value added for our patients. And the state and the federal government, through the ACA, the Affordable Care Act, that is affordable to all of our residents throughout the state of New York. And certainly we don't have walls at Nassau University Medical Center. As we know, we draw patients from various counties in the upstate area who have come to believe and have experienced the efficacy of care at Nassau. DSRIP will provide for us an opportunity to decrease unavoidable admissions, while at the same time provide a continuity of care, all right, that will assure wellness, will assure a good quality of life, and will manage any chronic disease that patient may have.
Right, and it's a major program here throughout the state, and it brings hospitals together. And so we're working collaboratively with the Catholic Health System. We're working with North Shore, Long Island Jewish, Winthrop, and South Nassau to keep that continuity of care between us all. And I think that we have a lot of work to do in that regard, but that the CEOs are working together, the senior leadership staff are working together to make that happen. And so, Mr. Gatto, Mike Gatto, Professor Gatto from Hofstra, also the Senior Director of Transition Care for Nassau University Medical Center. I want to thank you very much for being here today. I mean, you really gave a lot of information out there. I thought I was in one of your classes listening to, and I'm ready. You're going to give me some homework to write a term paper. But it was a really great, information that you put out there, and you're just part of what makes Nassau University Medical Center a special hospital, and that we are working together with some great great people are really going to make a difference here for healthcare. So, yeah, I thank you. So, I'm Dr. Victor Politi, the President and CEO of Nassau University Medical Center, here sharing an early Saturday morning with you guys. And we really want to thank you for listening today. And enjoy your day. Enjoy your Saturday. Enjoy your week. Stay healthy. We're here if you need us. And we mean that from the bottom of our hearts. So, again, have a great day. Bye.